If you're past 60 and notice yourself waking up more than once a night to urinate, or you constantly feel like your bladder never fully empties, or you find yourself standing there waiting forever for the stream to start, I need you to pay close attention, because those things aren't just a normal part of getting older. They are warning signs from your body, signals you should not brush aside. In my work as a urologist, I see this constantly, and truthfully, your prostate is trying to get your attention. Many men believe these issues simply show up because of aging, but in reality, most of the time age isn't the main problem. It usually comes down to your everyday routine. Small choices you make repeatedly without thinking can slowly cause your prostate to swell, become heavier, and much more troublesome. Here's the good news. When you understand these habits, you can change them. And once you do, your body has a remarkable ability to reset. Pressure eases, inflammation settles down, and comfort gradually returns. In this video, I'll reveal 3 common daily behaviors that appear harmless but actually encourage prostate growth. And I'll share what you should be doing instead. These aren't unusual mistakes. In fact, nearly every man I treat is doing at least one of them. The longer they continue, the more strain they place on your urinary system, the more inflammation they trigger, and the harder your prostate has to work. But you are not stuck with this. If your symptoms have left you exhausted, irritated, or worried, this is exactly what you need to hear. You are not destined for things to keep getting worse. Your body can repair itself if you stop aggravating it. Habit number 1, holding your urine for too long. This sounds harmless, right? You're out and about running errands, or you'd rather avoid a public restroom, or you tell yourself you'll go once you finish what you're doing. So you wait. Seems minor, except it's not. Every time you delay urination too long, you increase pressure, not only in the bladder, but also on the prostate. Let me clarify. Your prostate sits right below the bladder, almost like a soft ring encircling the urethra, which is the tube that carries urine out. When the bladder overfills, it expands downward as well as upward. And what lies directly beneath it? The prostate. Picture squeezing a sponge that's already sensitive. That repeated pressure irritates the tissue. Over time, your prostate reacts by becoming thicker and enlarged. Men who regularly hold in their urine can develop what's called bladder outlet obstruction. That's when the bladder tries to empty, but the passage narrows because the prostate has grown firm and swollen. The bladder muscle then must strain harder and harder just to push urine through. Besides being uncomfortable, this continuous overworking eventually weakens the bladder. Think of a balloon being overinflated every day. It stretches out, loses strength, and never fully snaps back into shape. That's exactly what happens to your bladder and prostate when you constantly hold it. The solution is easy. Listen when your bladder nudges you. Don't wait until the urge becomes intense or painful. Go as soon as your body signals it's time. This tiny adjustment can take a massive load off your prostate and allow inflammation to settle. Habit number 2, overlooking constipation. This one surprises many men. What could constipation possibly have to do with the prostate? The answer is quite a lot. When your bowels are backed up, especially with hard compacted stool, the pressure pushes directly against the prostate from behind. And instead of a quick squeeze, this pressure is persistent, like a brick resting on that sponge all day. Over time, this reduces blood flow, irritates nearby nerves, and stirs up inflammation that radiates into the prostate. And that's not the only issue. Constipation alters the chemistry of your gut. When stool remains too long, it throws off the fragile balance of bacteria in your gut. That imbalance sparks inflammation throughout the entire body. And you guessed it, the prostate is often one of the very first places to feel the impact. Unfortunately, the way many older men eat doesn't make things better. Too much processed food, too much red meat or cheese, and far too little fiber or water. This slows the digestive system down. What begins as mild sluggishness becomes a loop. Constipation leads to inflammation. Inflammation bothers the prostate. Swelling then makes urination tougher, and the loop just continues feeding itself. Here's the positive part. You can interrupt that cycle with a few easy changes. Add more fiber-filled, gentle foods. Think cooked vegetables, fruits like pears or prunes, oats, chia seeds, flaxseed. Drink more water. These small adjustments soften stool and remove the nonstop pressure your prostate feels when the bowels are clogged. Once digestion moves smoothly again, the prostate can finally unwind. It's like clearing a blocked hallway. When the path opens up, everything else begins to function better. Habit number 3. Sitting too much. This last one is something nearly every man over 60 battles with. Retirement often brings slower days. You enjoy watching TV, reading a book, or scrolling on your phone. Suddenly, you look up and hours have slipped by without movement. On the outside, it feels relaxing. Internally, though, the story is different. Your pelvic region, home to the bladder, colon, and prostate, relies on healthy blood flow. It needs movement, even tiny and gentle motion. Blood delivers nutrients and removes waste. Sit too long and circulation slows to a crawl. Lymph movement weakens. Waste products build up near the prostate. The prostate is sensitive and depends on fresh blood and oxygen to stay well. Without that steady flow, it becomes swollen, irritated, and inflamed. Gradually, this stillness encourages prostate growth. And because the change happens slowly, you may not notice until suddenly you're dealing with nighttime bathroom trips, weak stream, or constant urgency. The solution is what I call movement snacks. You don't have to hit the gym or run laps. Just stand up every 30 to 40 minutes. Walk across the room, stretch your legs, rotate your hips, swing your arms, and breathe deeply. These tiny bursts wake up circulation, refresh the pelvis, and deliver the motion your prostate appreciates. Picture your prostate like a sponge. If it sits untouched all day, it grows stiff and collects waste. But gentle squeezing and movement keep it softer, nourished, and healthier. So, there you go. 3 normal daily habits that quietly encourage prostate enlargement. Holding your bladder too long, ignoring constipation, remaining seated for hours without a break. Individually, they might appear harmless. But when repeated day after day, year after year, they create the perfect setup for urgency, weak flow, restless nights, and discomfort. The best part is this. You can change all 3. No extreme lifestyle shifts are required, just steady, simple improvements. Use the bathroom when your bladder first asks. Include a bit more water and fiber in your meals. And don't stay stuck in a chair all day. I've watched men in their 60s, 70s, even 80s improve night urination, restore stronger flow, and feel relief. All from adjusting these seemingly minor habits. It doesn't matter how long you've been dealing with symptoms. You are not helpless. Your prostate does not get to run your life. Take a deep breath. Remember, your body still wants to support you. Give it the opportunity. Your best years don't have to be behind you. They can still be in front of you. If this video helped, subscribe and share it with a friend who could benefit. Often the tiniest changes deliver the greatest comfort. And always remember your health is in your hands.